When I think about SafeCare, I think about us having an opportunity to support people with very challenging situations. You know, health and safety is hugely impactful for people, right? Like workplace injury has a huge impact on an organization, on a sector. It has a huge impact on someone's life. It has a huge impact on someone's family. And to help people so that they can go home at the end of the day without being injured and that they're safe and then go home to their family. I mean, that's a huge privilege and opportunity to be a part of. And that's what SafeCare does.
SafeCare, it's a sense of community. I think it's everyone who is at this company together. It's just coming together to make a difference.
What I love about SafeCare is that we make sure that we're giving people the education, the tools, the supports, the resources, so that they can return home safely.
The reasoning behind starting SafeCare BC was really a look at the total number of injuries that were happening within the sector at the time, and going back well beyond 10 years actually. There was a lot of data that showed that we just simply weren't doing enough as a sector at the time to actually address the issue of workplace injuries. So one of the options for us at the time was to actually look at setting up our own safety association. Tremendous support right from the outset. People were very excited about the opportunity to get additional training, to get additional research information, but also more importantly to be able to reduce workplace injuries.
I think one of the things that really drew me to SafeCare BC at the start was the fact that it was brand new. So here was an organization that was working in a sector that I love, and it's a sector I still work in today. It's supporting older adults. And then to be able to start with something that was brand new was incredibly exciting. It was like, wow, here's a blank slate. Take your imagination to it, go out and speak to people, and then design something from that that will hopefully have impact in a really meaningful way.
So I was excited to have Jen on because she would actually begin taking away a lot of the duties and the work that I had been doing for both organizations for the period of a year. And what I wanted her to do was to basically begin putting the pieces of the structure together to build a really strong relationship with WorkSafe BC. She had to effectively get a new board and get people recruited. So she had a lot that she had to do in that first year.
I think the biggest thing for SafeCare BC, and when I started, was really being able to realize that fundamental idea that everybody should go home safe and healthy at the end of their shift. Doesn't matter what they do, doesn't matter what their role is, they should go home the same way they came into work, safe and healthy. And so that's something that I really wanted to see. The idea that they would be able to go home safe at the end of the day was really important to me. And I think more broadly, what I was really hoping to see with SafeCare was an organization that was vibrant and really driven by the grassroots, so that it was doing with people working in the sector, not to, not for. The idea that SafeCare BC could drive down injury rates, it could engage with people working in the sector in a really meaningful way, but also by extension, create a better quality of care for the thousands of people in British Columbia who rely on that system for their own well-being.
What was really beautiful to watch was some of the research we had obtained was that not all safety associations over time have that alignment with their safety associations. So what was really neat is that we set it up through the industry association, but we wrote the bylaws, we designed the name, we worked with the membership to make sure that the two organizations were very much working in tandem. So I ended up, if I go back in my memory bank, I recall I probably had like 10 or 15 or 20 different names that I had come up with. And then SafeCare came out. What I did was I took words that I thought were associated kind of with the sector, and safety was one of them, care is another. It just flowed so well.
I don't know if it was real or perceived, but I felt a lot of pressure to be able to demonstrate impact in the first year. And so one of the things that we set right out the gate was we are going to have a meaningful consultation with our members to inform our first ever strategic plan, and we did it. We are going to deliver our first workshops, and we didn't have anything, and we did it. We are going to foster some really meaningful and strategic partnerships, and one of those very early partners was the Alzheimer's Society BC, and we did it. So for me, the goal was really in that first year, this is our opportunity to prove that this model can work. We were really fortunate to have a strong partnership with the BC Care Providers Association, which was incredibly instrumental, especially in getting that access and insight to our membership. And also from a very practical standpoint, when you have only one employee in an organization, how do you get all the work done? So the first year, I think we went from 1 employee to 2. And it felt amazing to have 2 people. It's like, wow, I don't have to organize this workshop and find a venue rental for our very first dementia workshop. There's somebody who can help me with that.
I was hired as the second full-time staff at SafeCare to help develop the programs that we offered to our members around occupational health and safety. It was a brand new position, a new role, and I really looked at that as a way to kind of shape the type of education and training that we could bring to care workers. And so it was exciting to do something like that. Trust to me is something that gets built over a long period of time where you have an opportunity to connect with people both professionally and personally. And so this has been a journey, I think, for SafeCare since the very beginning. And there's so many people that work in the sector, that work in healthcare, but also in health and safety in this space, that have been doing this work for a long time. They've had successes and they've also had failures. And I think what we tried to do was really learn from the successes and the failures to make sure we weren't making the same mistakes, but also look to those people as partners, people that we could leverage, people that we could support with their pain points, so that we could really make sure we were taking the work that was already happening and make it more available, but also create net new that they could then use within their own organizations.
We know that there's a lot of organizations that don't have, dedicated full-time health and safety resources, and that's why they come to us. To be able to support those organizations so that people can feel safe at work, not only physically, but also psychologically. I mean, how great is that to be able to do that, to have that opportunity? And that's us. Like, SafeCare is able to do that. That feels great, and that should feel great for our team. That should feel great for our partners and the people who are connected to us, that we have that opportunity to make people's lives so much better and to help organizations that are challenged by issues of health and safety. It's huge.
When I started at SafeCare, we were offering the safe handling education, which was really important. After that, we brought on the violence prevention curriculum, and then we created a leadership course for nurses. So from that, we developed the safety education for RNs, and then we also developed safety education for LPNs. And that course, I think, has just evolved over the last several years.
When I started at SafeCare pre-COVID, we only really offered in-person training. Everyone had to be in the classroom at the same time with an instructor. During COVID, we put a pause on all of our education. Obviously, there was still a need for education once we had kind of settled into the new normal of COVID. So trying to balance how we could make that possible so that our learners were still getting the education they required, but they weren't losing the quality of education. So we very quickly had to pivot. So having to switch everything over was very scary, and we did it within a week.
For a lot of organizations, the pandemic had a significant impact on our operations and what we did and how we served our members, but in a very positive way. And I think that the pandemic was a pivotal time in the history of SafeCare BC. It was a watershed moment in a very positive way, in that we were able to respond to the needs of our members, which were very significant at that time, in ways that were direct and very quick. So, the pandemic hit and organizations were being challenged in a number of ways. Getting communications from different health officials, secure personal protective equipment, which was a real challenge for our members and especially for small organizations because there was a shortage of PPE, and so they turned to us for that assistance and that help.
SafeCare BC is collecting unused medical equipment, including N95 masks, gloves, hand sanitizer, and hospital-grade disinfectant wipes. It says restaurants, salons, and even farmers have already pitched in. The group is picking up large donations and is setting up drop-off locations in Vancouver and in Surrey.
There was a change, a very positive change with SafeCare BC, in that we responded to our members' needs so quickly, and we're able to serve them in so many ways that in some ways wasn't in our mandate, but we had to do it. And then organizations saw us in ways that perhaps they hadn't seen before.
We also have direct donations from a lot of great companies like SafeCare BC, and it was announced earlier today there's now the COVID-19 Supply Hub, where we can collaborate, we can tell people what we need, and government and businesses around the province can contribute to that.
Operation Protect was really the moment that SafeCare grew as a company. I remember one weekend getting a call from Ken, and on the weekend you never expect to get a call from your boss. He's asking me, can I whip up a logo for this thing called Operation Protect? And then to really see what this idea that started with Ken really bloom into this thing that was just so helpful for so many people. Everyone at SafeCare at the time played a part, whether we were going out personally to collect PPE or making deliveries, or behind the scenes to just make these connections, to have people come together and support each other. It was a huge moment for us.
We recognize that the psychological wellness of healthcare workers was being compromised by the pandemic. Within a month of the pandemic being declared, SafeCare very quickly partnered with the Canadian Mental Health Association. We are providing resources for healthcare workers because we saw immediately that they're being impacted in this way. Care to Speak, care for caregivers. I think this, again, is a testament to SafeCare. We were nimble. We're able to pivot and to say, there's this need. How can we help support that need?
It really felt we were making a difference, and I am still amazed at how we all kind of shifted gears. And we supported a sector that for I think the first time really realized the power of the work that we did.
And what you dropping off today?
We're dropping off some masks and gloves, and it's from Austin Metal Fabricators.
Excellent, thank you so much.
You're very welcome.
Thank you very much.
You're very welcome.
Have a good day.
You too, stay safe.
Thanks a lot.
We had a 3-day supply of PPEs, but we were out on our own a bit. And so I saw this ad from SafeCare BC, and we got 1,000 masks, and that saw us through the COVID crisis. SafeCare BC is really helpful.
Thanks, kid.
But one thing that I thought was done really, really well during the pandemic was SafeCare's ability to really step up and lean into helping organizations support their employees in around emergency planning. It feels kind of surreal when we look back and we replay those moments, but it's also extremely humbling and kind of gets you in the back of the throat a little bit when you realize the sacrifices that so many people made.
Going back, we really had to make sure that we had supports in place to support organizations to ensure that their workers felt safe. So we had developed resources around that, COVID-19 safety plan templates that employers could just take and kind of adjust to what they needed in their own homes. I think the other piece too is really going to the workers and seeing what they need and getting their input and asking them, like, how can we support you in the work that you do and for you to do it in the safest way possible. When you go to the workers, they often have the answers. And so I think engaging the workforce in their health and safety is really, really important.
Healthcare workers are often selfless people. They want to help other people, but the thing is, sometimes we need to help them and they need to help themselves, because if they can't care for themselves, they won't be able to care for their residents and the clients, but also their own families. And the member survey allows us to get a sense of what are the needs of organizations. Like, what do they need? Like, what are their health and safety concerns? What are their top 3 challenges when it comes to health and safety? And then we're able to then respond to that.
We always talked about how it's wonderful that we're able to train people in the Lower Mainland, but realistically, our membership spans the province. It was always a goal for us to make sure that we were providing equal access to education and training to anyone that worked in our sector across the province. And so this idea of satellite training centers came about where we said, wouldn't it be cool if we could take the education that we offer here in one place and deliver that same education to a care worker in Abbotsford, in the interior, on the island, and make sure that it's the same type of education that's being offered and give people an opportunity to come together in that learning environment.
I like to say that being asked to assume responsibility for Hearts and Hands is 2 things. One is a huge gift for SafeCare. I take it on as it's also a huge privilege, in the sense that there was this celebration, acknowledgement. It was like a one-day event is how it started, and then it morphed into a conference. And then all of a sudden, it's like we are gifted this opportunity to give back to healthcare assistants. And I see it as a privilege in the sense that it allows us to build and grow that event from what it was, and we continue to do this to make it better, to increase the number of conferences we've had, but never losing sight of its intention. And I think that's important. It's not just a conference. It's bigger than just a conference. There's something just really special about it. And for us as an organization to be able to host it, to organize it, to bring people together is like a huge opportunity. It's fantastic. Like I say, it's a gift.
People are so hungry to learn. They're like sponges, and there's a very nice atmosphere that you sense.
I get to do a lot of events, but this one was special. A, because it's people who work in a field that I have directly benefited from, but also because you can tell that everybody in the room really wants to be here, which is not always the case, right? And just the appreciation that they have for the opportunity to get together, to be appreciated, to be acknowledged, I think is really, really special.
You know what, as always, SafeCare has managed to grasp the concept of what care aides do, and they've done an excellent job of showing their appreciation for all that each and every one of our amazing healthcare aides do each and every day.
How do you make health and safety fun?
Welcome to the 8th annual Safety Den, which is brought to you by SafeCare BC.
Safety Den is kind of the answer to that question. I think a lot of people would say, no, you can't. But for us, we kind of took that challenge and said, no, we want to put together this almost game show and really use it as a chance to celebrate and show off the innovation that exists in healthcare, because there are so many great ideas out there, and this is our chance to spotlight them.
I remember several years ago where this room was nearly empty. And now I hear from so many people that this is a highlight of the conference and they can't wait to come because people have so much fun.
What did you think today?
What did I think of today?
Yeah.
I thought it was a great example of innovation in action, and it was also a testament to our connection as a community and our commitment to our residents.
a day where we bring everyone together, put them on a stage. You know, this is kind of out of the norm for these people. Sometimes, a lot of times they're frontline workers or managers, and it's just it's a great chance for them to just show off and be appreciated. In healthcare, support services workers are kind of the unsung heroes of the unsung heroes. I think a lot of people don't realize just how directly and indirectly these workers affect the care that our loved ones receive. It's everything from making food to making sure their home is well kept. And so early on, it was really acknowledged that there was a need to show our appreciation for these people. And so that's really where Support Services Day came from, just our chance to say thank you to these people and remind them that they are not just a part of the care team, but a very important part. Events like Safety Den and Hearts and Hands are really where we see firsthand just the impact we have as a company. We work in an office where we're behind computer screens. We're not seeing directly the work that our members do. When we have a chance to go out in the field, see our members in person, it's a reminder of why we're here, why we're doing what we do.
It's my hope that health and safety is not just an extra thing that people have to do. I want it to be something that's ingrained in the culture of every organization that we support. The first thing that people think about when they walk into a care home, the first thing that a worker thinks about before they go and they provide that personal care to the resident that they care about, I want them to think about themselves and their colleagues and keeping them safe so that we can continue to have a group of healthcare workers providing this level of excellent care to people in the province.
I think there's a huge opportunity for SafeCare to expand our, not only the services and programs and resources that we offer, but also to support more organizations. I think there's a huge need for, organizations to support workplace health and safety that aren't currently being met, and that we can help fill that need and to support those organizations and to ensure that their workers are healthy and safe. So being able to expand, our membership and the people we serve, I think there's a huge opportunity there.
By 2034, it's my hope that health and safety is fun. It's exciting. It's something that people want to take part in because they recognize that the work is valuable and it has an impact on the place that they spend so much of their time that they want to make better.
I feel really fortunate to have had the opportunity to start with an organization that's just an idea on paper and be able to turn that into something that lives and breathes out in the community and is having impact. That was really deeply meaningful for me.
Successful organizations, there's a lot of people behind those successful organizations. And the success of SafeCare and where it is today is a testament to the people, like the current staff, former staff, board members, and all of our partners. We couldn't have the success we have today without all of their support. And so really it's thanks to them that we're able to do what we continue to do.
The people that work at SafeCare, they're a special group. They really are. They all have health and safety in the forefront. And it's a service industry we're in, right? We serve our members, and I think everyone in our team has that mentality and that drive. And we all have our different gifts and our different skills, but we all work so well together. It's just such a great place to work.
There's been so many great people over the years that have been a huge part of SafeCare's success, from all our staff, current and former, to our members, people on the frontline committee, everyone who's participated in Safety Den, everyone who's gone to Hearts and Hands. I'd be here all day if I was going to list everyone, but they've all been a huge part of SafeCare.
I like to think of every person that supports SafeCare BC is as important as the next. The way I think of that is that if we have an HCA who is new on the job and goes to a SafeCare BC website and finds some piece of information that can help them in their work be safe, that contribution to supporting them, or listening to the podcast or watching a safety video or some piece of social media helps keep them safe. That is as important in some cases as a corporate vendor who is donating money or wants to have a collaboration or a partnership with SafeCare. It's different, but it doesn't, to me, the value is the same, because we need everybody to be using the resources that we have so that they can tell someone, hey, go to SafeCare BC, because they're the leaders and we trust that the information they're giving us is the best information out there.
I've worked at small organizations and large organizations, and sometimes when you're working for a large organization, you just feel you're like a number. You don't really have impact. You work in a small organization, not only do you have an opportunity to do a lot of diverse work, but you have an opportunity to see how your work is impacting people directly. I really like that. And the other thing is the team. And so over the 7 years that I've worked at SafeCare, the team has obviously changed. There's some people that have been there for a while, but you get turnover, you get new people. And it's almost like it doesn't matter when new people come in, there's still this core foundation of a great team.
There's so many people that have supported SafeCare over the years. So of course, I'll be forever grateful to Jed Lyle for laying the foundation for this organization, for bringing me on as that second hire. Daniel Fontaine, who is a huge supporter of SafeCare BC and talked about us at every media opportunity he was able to. And Terry Lake does the same thing. Every chance he gets, he promotes SafeCare BC. He's been a fabulous mentor for me, and I'm very lucky to have worked with him. And all of the people who have served on the SafeCare BC board, who I've gone to for guidance, for support, for help with challenges, and for new ideas. The people that sit on the SafeCare BC board are tremendous. They volunteer their time, and they care about the work that we do.